Welcome to Health Matters, and on today's episode, we've got a special guest. You've probably seen him on TikTok, and we've got him today. This is Dr. Mushambadzi.
Yep.
Thanks for making time for me to talk a little bit about oral health.
Yeah, no, thanks for having me.
So this is going to be a question and answer session. I'm just going to be throwing questions at Dr. Mushambadzi. I got a couple of my friends and relatives with a lot of questions about oral health, and he's just going to be responding.
Okay.
So, first and foremost, a lot of people ask, what are caries, doctor?
So caries, basically in simple terms, caries is just tooth decay. Okay, so it is the oldest and most common chronic disease that a lot of people don't know about. So basically, it's just a rotten tooth decay when the bacteria has produced acid in your mouth and starts to dissolve the tooth, demineralize the tooth.
It's a big word, eh? Yeah. So basically, if I have a hole in my tooth, that's cause of caries.
Yeah, that's dental caries.
So are they infectious?
Yes, it is an infectious disease because it is a specific type of bacteria that actually causes the whole process. This bacteria is transmitted from person to person, but almost everyone has it.
All right.
Okay, so you're not born with it. It is transmitted to you from your caregiver, your mother, your father, any loved one that gets any saliva contact onto the baby. That's how it's transmitted.
All right. Thanks about that. Next on the question, Doc, let's talk about braces.
Okay.
Who needs braces? Is it a fashion statement? What really happens about braces? Tell me more.
So with braces, it's been made to seem as though it's a fashion statement, but it's actually a very functional thing. It is treatment of a disease, and that disease is called malocclusion.
Another big word.
So that's the name of the disease, and basically braces, what we're trying to do is we're trying to get your oral facial harmony in check. So the way your jaws come together, the way your teeth look, the way they function, all of that is what we're actually treating with braces.
So basically braces are an aesthetics fixture.
I think that's an interesting way of saying it. Yeah, it's not incorrect. It's very correct actually. It's aesthetic, but in fixing the aesthetics, we're also fixing the functional. Great. So for example, if I can give you an example of someone who has crooked teeth, that crookedness is because the jaws didn't have enough space for all those teeth to come out in perfect alignment, and it then has other issues like you can't adequately or efficiently clean your teeth. Your gums then get inflamed. So us correcting that solves a lot of other problems that are not just aesthetic.
Oh, it's a lot to learn today.
Yeah.
And then speaking of aesthetics, let's talk about veneers, Doc. If you go on TikTok, you scroll on TikTok, you're probably going to see some lady in the States doing some veneer treatment and this dodgy place. Tell me about veneers.
So veneers are a hot topic globally. Veneers are a hot topic. And what I would say is they are necessary. They are part of our training. They are part of the services that we provide. But what I would say is get them done by someone who knows how to do it. Okay, so you'll find that there are these garage dentists, for example, especially in the States, that's a thing, where someone who doesn't have the qualification or the expertise is doing things that they just don't know how to do. So they are very safe, they are functional. For example, if someone has fluorosis, so fluorosis is something that's common in certain parts of the world.
Doc is throwing the big words, man. The big words, man. Fluorosis.
So fluorosis, for example, is found in different parts of Zim.
Okay.
That's where someone can have, it ranges, but some can have like brown streaks or white patches on the teeth. Veneers are a very good way of fixing that. And what we're doing is we are basically just putting a very thin layer on top of the tooth. Very minimal preparation on the tooth. It can either be a ceramic material, porcelain, or a composite material. But if they're done right and done by someone who knows what they're doing, then
there's no problem about that.
No problem at all.
Right.
No problem at all.
Let's move on to the next question. Wisdom teeth. Is it a big problem if I'm a grown-up and I don't have wisdom teeth? And are they really functional? Because couple of people say, you know, you don't need wisdom teeth. When you get them removed.
Yeah.
Tell us about wisdom teeth.
Okay. Wisdom teeth, typically they erupt between 17 and like 25.
Yeah.
So nowadays we're seeing it more and more that adults don't have their wisdom teeth, or they have them and they are crooked. They're not, you know, sitting in the jaw the correct way. They're just looking awkward and trapping food and all of these things. So only personally, I mean, there's so many different trains of thoughts when it comes to dealing with wisdom teeth. But wisdom teeth can be functional, and their functionality only comes if they are erupted in the correct direction and if it has an opposing tooth.
Okay.
So a lot of the time we'll have the top wisdom tooth and then the bottom one didn't show up. It could be in the bone, didn't erupt, or you are just one of those special people that doesn't have wisdom teeth.
Okay.
And that is actually something that's becoming more and more common. So I wouldn't say you should be worried if you don't have them. But I mean, these are the things that we actually check for when you come for a routine dental
checkup.
Yeah.
All right.
So take x-rays to see if the wisdom teeth are there, if there's any issues that you could expect them to cause. But typically it shouldn't be something that you worry about. Wisdom teeth should only be removed if they are posing a risk to neighboring teeth, to your health, to your comfort, just social issues as well, like bad breath, which they also play a part in. But yeah, otherwise there's absolutely no problem not having wisdom teeth.
I mean, let's get to the main issue, Doc. Thank you for introducing.
Oh, okay.
You already know it.
Yeah.
Bad breath.
Bad breath.
Bad breath.
Topic, yeah.
It's the hardest topic. Everyone is waiting for us to ask about bad breath. How do you communicate bad breath to someone? What causes bad breath? Take us through bad breath. That's why we're here.
Okay. So bad breath, the fancy word for it is halitosis.
A big word.
So halitosis, and basically it's just a foul-smelling odor coming from the mouth. There are so many causes, and I think I can confidently say about 70% going up is because of your oral cavity.
Okay.
So many issues bad breath is something that it's never a comfortable thing.
It is.
Even if it's a loved one who has bad breath, or a stranger or someone who you're working with, it is something that is quite uncomfortable and can be awkward. So the causes of bad breath can range from, you've got the cavity. So that dental caries that we talked about, you've got a cavity, food is getting stuck in there. You can't remove it. Okay. You are not flossing your teeth, so food is getting stuck in between your teeth and you're not removing it. Inflamed gums as well causes bad breath. Your tongue, so your tongue it harbors all of that bacteria that actually causes most of your bad breath. So if you're not scraping your tongue, if you're not cleaning your tongue, then you know that bad breath
is bound to come.
Yeah, it's bound to come. So you just imagine your tongue as being like a mat or a brush, and everything that you're eating is just rubbing up against that. So it has to be cleaned just the same way that we clean our teeth, our gums,
Okay.
So those are typically the things that cause bad breath. Food as well, the things that you eat, all of that. But more often than not, if someone has a good oral hygiene routine, so that's the brushing, the flossing, using mouthwash, they are not going to have bad breath. No. That is almost, that is the main thing. If your oral hygiene, those three things include scraping your tongue as well, then you shouldn't even have an issue with that. Of course, there are other issues where it can come from your gut.
Okay.
So for example, someone who has indigestion or heartburn can also have a foul taste coming out. In diabetic, this is now more your area, but someone is going in like a ketotic state. That's keto breath.
Especially when you're fasting. Don't forget to take sweets when you're fasting.
Exactly. Hunger is another thing that causes Yeah. So those are the typical things.
All right. That's quite a lot of information to digest and quite a lot of things to learn in one go. But let's talk about how often should I see a dentist?
Okay. So what we recommend as dentists or oral health professionals is at least every 6 months.
But what if my teeth are good?
Okay. I mean, that's a valid question, but how do you know your teeth are good?
I don't have pain.
Yeah, so I mean, even if you don't have any issues, any symptoms, the good practice is to visit a dentist, to get a consult, so that at least you know exactly what's going on in your mouth. There may be things that are starting to happen, so that caries may be starting to happen, and you want to stop it when we can, before it gets too late. And I think it's our health-seeking behavior as people is quite poor, where we only want to go and get assistance
in the last minute.
In the last minute, where things are. It's now chaos. It's now a crisis. So that's what we try to avoid by saying preventive measures are always better than curative measures.
Okay.
Every 6 months or at least once a year, so that even if we're not doing anything, at least you have that confidence that I'm fine. My teeth are good. If there's something I need to work on, let me do that. Because toothache is a special type of pain.
There is a debate. Unfortunately, there's no lady in there.
Oh yeah.
There is a debate. Toothache, labor, broken bone.
I'm a bit biased, but toothache. I mean, yeah.
It's a level.
Yeah, that's the next level pain. That's the next level.
Hey Doc, thank you so much for the information you've given us.
Yep.
This has been the first of our episodes of consultations where we meet specialists and we discuss a lot of things. If you've got more questions for Doc, we're going to put his link to his TikTok. Make sure you follow him. You go to the dentist twice a year.
Yeah.
You keep your breath good. And let's meet next time on Health Matters.
All right, awesome. We should do this again.
Sure.
Yeah.